Today we'll be demonstrating a functional hip spica for an adductor strain and for early return to sport. The purpose of this wrap is to provide mild compression and mild to moderate support of a hip adductor while treating a strain. The first thing we want to do is ask the participant or the athlete if they have used the washroom beforehand, because this wrap, once applied, is difficult to take off. Next step is to get them in the proper stance. So we're going to get our injured leg in the front into slight internal rotation and slight knee flexion, and we're going to want to weight bear on our non-involved leg, which is the back leg. Next thing, we're going to want to apply a wrap starting on the lateral distal aspect of the thigh. We'll get our athlete to hold the wrap while we wrap around, providing just a little bit of tension. After the first wrap, we're going to dog ear to make sure that doesn't fall down while they're participating. And we're going to keep wrapping around. We'll go once more, overlapping by about a half or 1/3. Now we're going to want to pull to the iliac crest of the non-involved hip, providing lots of tension, wrapping around the hip, and once we're around the back, we're going to release, and then we're going to pull a little bit again, finishing in the groin. We're going to wrap around the thigh again, and we're going to repeat this step one more time, providing lots of tension. And now we're going to wrap around, pulling once again. Usually for about each individual, we're able to do this about 2 times. So we're going to finish over top here. I'm going to make sure we don't finish in the medial aspect of the thigh, because that's for risk for friction or rubbing while running or participating in your sport. So we're going to get our athlete to hold the wrap right here while we get our pre-wrap to finish this up. We're going to wrap around, overlapping again by about a half or a third. That looks good. Next, we're going to get our elastic tape, and we're going to do strips around the thigh to keep this in place so it doesn't go anywhere. That is 1. That's 2. And we'll do one more. Now we're going to finish last step with our non-elastic white tape. We're going to cover up these endings to make sure that they don't peel or fall off while we're participating. So just some nice strips right on the front here. And we'll do one last one. There we go. Once we know that's in place, next we want to test the circulation. So we're going to do a cap refill on the big toe here to make sure there's still circulation, which yes, there is. Next, we're going to want to test the effectiveness and the functionality of it. So for effectiveness, we're going to want to make sure it's doing what it's supposed to do. Is it assisting in your adduction? Yep. Is it limiting your abduction? Once we know that it's doing that right, we can test the functionality. So for this athlete, they are a soccer athlete, so we're going to want to make sure they can still kick, hip flex at the knee, extend at the hip. Maybe we want to make them do like a squat, make sure it doesn't fall off. Once we know that it's functional, they are ready for action.